Hello, in this video we'll explore the electrical and the mechanical events of the heart. We're going to cover action potentials, we're going to cover ECGs, we're going to cover cardiac muscle contraction, and we're going to cover the effects of neurotransmitters and the cardiac cycle in the left ventricle and aorta. Okay. So the ventricle muscle cells have a 5-phase action potential. Phase 0 is depolarization. The sodium channels open, sodium channels rushes in, and the membrane potential jumps from -90 to about 20. And then we have phase 1, which is initial repolarization. This is when the sodium channels are inactivate, and then the potassium channels open, and there's a small drop in the membrane potential. That is the drop. Phase 3 is the calcium channels close, and I'm skipping one. The phase 2 is the plateau. That's when the L-type calcium channels open, and the potassium efflux continues, but the membrane stays near 0. And phase 3 is when the calcium channels open, and the potassium efflux dominates, and it brings it back down to -90. And phase 4 here and here is resting. That's what it is. Those are the phases. Okay, phase 4 is called the funny current, and so I'm actually going to redo this. Phase 4 Phase 4 is called the funny current. It gradually depolarizes the cell. Phase 0 is when the L-type calcium channels open, and that's when there's a rapid upstrike. And this is all for the SA node action potential. SA node has a pacemaker potential, which slowly depolarizes until it reaches threshold. And then phase 3 is when potassium channels open, and it repolarizes. This automatic firing, it sets the heart rate. Okay, so this is what ECG looks like. The P wave is the arterial depolarization from the SA node. That's a really bad ECG, by the way, but we're going to work with it. And the QRS complex is the ventricular depolarization, and the T wave is the ventricular repolarization. The ECG is a measurement of the electrical events that we just taled about from the SA node. Okay. Oh boy. Okay. We're going back. We're back. We're back. Okay. So in the heart, there's a heart, a blocked coronary artery, within the ischemic area, and a partial blockage, meaning that you have some ischemia and the ST segment is normal. Um, that means that you have NSTEMI. STEMI is the complete blockage, where the full thickness of the myocardial infarction in the ST segment is elevated. In these two, we're gonna have two. We're gonna just show two hearts here, actually. Oh, this is not good. Let me go like this for a second. Oops. Okay. NE is for norepinephrine. That's for the sympathetic nervous system. There's a neurotransmitter effects on ECGs in the heart. Acetylcholine is the parasympathetic nervous system. Norepinephrine is going to bind to beta 1 receptors, which increases CAMP. There's three subcategories here. We have chronotropic, which leads to the high amounts of the SA node firing, which means high heart rate. Inotropic is high calcium, which is a stronger contraction, and lusotropic is high calcium reuptake, which is faster relaxation. That's all for norepinephrine, or the sympathetic nervous system. And then acetylcholine binds to M2 receptors, which means that you have a high potassium efflux, which means you have hyperpolarization going on and decreased heart rate. Get it? Do you understand? I'm going to erase this. Okay. I'm going to talk about calcium. This is a sarcomere. It's got actin and myosin. The calcium is going to move from the sarcoplasmic reticulum to the extracellular fluid in a contraction. Calcium enters L-type channels during phase 2, and that triggers the calcium-induced calcium release of the sarcoplasmic reticulum, which binds to troponin with actin-myosin and actin-myosin cross bridges, which causes contraction. Relaxation is calcium is pumped back into the sarcoplasmic reticulum through sarcopumps and out of the cell through the sodium calcium exchanger. Calcium. Okay, isovolumeric contraction means that the left ventricle is contracting and that the pressure is rising because we're having contractions and the valves are closing, which means you're going to have the S1 sound. Lubdup. Ventricular ejection is when the aortic valve opens and the blood is ejected and the pressure peaks. Isovolumeric relaxation means that the left ventricle relaxes and the valves are closed. This is the S2 sound. And the ventricular filling is that the AV valves are opening and a passive filling and the atrial contraction tops off volume. The volume rises and falls with filling and ejection, and the pressure rises during contraction and falls during relaxation. So that's all I got.